Good day, everyone. My name is Noveline S. Solaris, and my report is all about use of graphic techniques in personality. Now, graphic techniques in personality assessment was come from, or some of them was come from the book of Karin Machever called Personality Projection in the Drawing of Human Figure. Little did Karin Machever realize when she published her slim monograph on the Draw a Person test or the DAP that it would spark a controversy that has spanned the last 50 or so years. However, the use of graphic techniques as personality measures has no standardized method for their administration. Many scoring methods exist for the analysis of the test, but no single comprehensive scale has been devised that is reliable or valid. Therefore, graphic techniques are typically not looked upon or as respectable measures by researchers. However, the rich clinical data they generate make them quite popular with clinicians. In my report, we are going to describe the DAP or the draw a person, the house tree person or HTP, and the kinetic family drawing or the KFD. Moreover, we will also discuss the administration of each test, the current research status, use in clinical practice, and a variety of other considerations. For a draw a person test, it was devised by Karen Matrover. It was based upon the observation that Joe Amen test productions reflected personality issues as well as provided a measure of intelligence for which the DAM was devised. Now, although there are several different sets of directions available, the typical instructions are described as follows. The patient is given a sheet of 8.5 by 11 unlined paper and a number 2 pencil and is simply asked to draw a person. The examiner should answer all questions non-directively. Do it in any way you like. The patient who expresses concern about his or her artistic ability should be told, this is not a test of artistic ability, so that's not important. If patient asks whether they should draw the entire figure or just the head, or whether a stick figure is acceptable, they should be instructed to do as they wish. However, if they draw only the head, or if they draw a stick figure, they should be then given another sheet of paper and asked to draw an entire person or a person that is not a stick figure. The patient is then given another sheet of paper, is asked to draw a picture of the opposite sex or gender, and is then asked to make up stories about both drawings. Now, if the patient cannot do so, it is acceptable to ask a series of questions about the person drawn. On the other hand, Kissen outlined a modification of the DAP administration based on object relations theory, which he feels enhances the psychodynamic potentiality of the DAP. Now, in this way, he encourages the patient to adopt an attitude of naivete and curiosity toward his or her own drawn figures, and he then invites the patient to explore psychologically some of the salient expressive characteristics of the human figures produced. Now, in that way, the patient becomes a consultant, allowing him or her to become spontaneous and open to inner experiential states. Kisan also recommends saying, I would like you to look at your first drawing as though it were drawn by somebody else. From the physical characteristics of the drawing, facial expression, posture, style of the clothing, what sort of person comes through to you? What personal characteristics come to your mind? Now, questions are also asked concerning how the person might relate to others of his or her own gender and to others of the opposite gender. For the house tree person, or the HTP, it was developed by John Bach and Emanuel Hammer. Bach in the United States and Emil Jacker in the Switzerland independently noted that tree drawings could reflect underlying personality traits. Jacker's student, which is Charles Koch, developed the tree drawing as a projective test. Bach added the house drawing as in part a representation of the self to form the HTP. Now, Hammer, on the other hand, indicates that the house and tree drawings were also used because they were familiar items even to very young children, and most people were quite willing to draw them. And that the reasons for using the HTP are essentially the same reasons cited for the DAP. Now, HTP is said to reflect patients' feelings about their home situation, typically represented by the house drawing. The tree drawing is said to also reflect patients' emotional history and to tap deeper layers of personality. Now, for the direction, the examiner should use sheets of 8.5 by 11 unlined paper and a number 2 pencil and should ask the patient to draw in order as good a picture of a house tree person as they can and each on a separate sheet of paper. The examiner could then also ask for a drawing of the opposite sex or gender. As with the DAP, the examiner should answer all questions about the drawing task in a non-committal manner. It is also important to record all spontaneous comments to assist in the later interpretation of the data. Now, Bach recommends that the patient be asked a list of questions regarding the drawings. The examiner asks clients to make up stories about each drawing. Some examiners substitute an open-ended questions of stories, such as tell me about this house or the tree or the person. Now, for the theoretical basis for both DAP and the HTP, DAP is described as a projective test where people are said to project underlying personality dynamics and the personality traits into their drawings. It is typically believed that patients' DAP productions are a reflection in some way or another of himself or herself, but it is also possible that the drawings represent some other important person in the patient's life. Now, projection of these personality traits and dynamics is not typically reflected directly or consciously, but is presented symbolically in some indirect manner. Thus, people do not draw themselves as they appear, but as they experience themselves or as they wish to be. The opposite sex drawing is often said to tap attitudes about people in the patient's life who are of that gender. Typically, the DAP is analyzed using ego psychological and object relations theories, although recently Leibowitz described DAP interpretation from a self-psychology viewpoint. On the other hand, HTP, the theoretical underpinning of the house tree person is similar to that of the DAP. The patient is said to reflect underlying traits and personality dynamics indirectly, and the house is also said to be symbolic representation of the self, and it taps unconscious issues concerning the patient's present or early family life. The clinical observations also suggest that the house drawing represents the patient's attitudes and emotions concerning present family relationships. Hammer and Koch believe that the tree drawing reflects deeper and more unconscious feelings about self, compared with figure drawings, which represent a closer to consciousness view of self in the environment. Now, the HTP was devised from psychoanalytic principles, but recently some clinicians have interpreted HTP data using a humanistic or a phenomenological approach. For the test development for both DAP and HTP, there are numerous DAP rating scales available in the literature to score various aspects of the drawings. For example, Witkin, in a series of studies, developed and researched the concept of field dependence independence, and later it extended the concept as psychological differentiation. It is defined as a person's articulation of his or her experience of the world and of the self, the development of a separate sense of identity, and the development of defensive style and structure. Witkin, moreover, developed a global scale derived from Matrover's work, called the Sophistication of Body Concept Scale. It was based upon the degree of primitiveness and oversimplification of the drawing, such as circles or ovals for bodies, or stick figures, omission and distortion of body parts, and the lack of sexual differentiation of the drawing. Now, many of these signs are those that some researchers described as poor artistic ability. They are some of the same variables that Handler and Rayer describe as valid indicators of conflict or anxiety. However, to a great extent, differences in artistic ability are related to personality style. Nevertheless, they recognize that there are indeed large differences in artistic ability among people. However, it is not difficult to differentiate drawings due to poor artistic ability from those that represent a poor psychological differentiation of the self. There are a number of conflict or anxiety scales in the literature for adults and for children. Unfortunately, there is no scale available to score the verbal material obtained in the administration of the DAP. Kopitz identified certain emotional indices as representing different conscious or unconscious attitudes. For example, tiny figures of the omission of nose, mouth, and hands was associated with shyness, timidity, and withdrawal, whereas gross asymmetry of limbs, the presence of teeth, long arms, and big hands, and the presence of genitals was said to be associated with a hostile attitude and impulsivity. On the other hand, for the HTP, Bach constructed a quantitative scale to measure intelligence. But it is rarely ever used clinically in research. He also devised a very elaborate scoring system as a personality measure, but most clinicians do not use it in their clinical work. Instead, they analyze each drawing impressionistically, or they use box sign approach method. While the specific HTP signs are often used in research and in clinical application, psychologists typically understand that no single interpretation is adequate for any drawing sign. For example, Hammer indicates that for some patients, the chimney of a house may represent a phallic symbol, while for others it represents just an important detail of the house. Now, the next one is psychometric characteristics for both DAP and HTP. The test retest reliabilities range for the DAP range from fair to good. The inter-rater reliabilities of for the various scales range from good to excellent. And moreover, the norms are available for both children and adults, and the changes in children's drawing follows a developmental pattern. Example, um, drawings of normal adolescents typically reflect their predominant age and stage related problems or conflicts, which should not be confused with with psychopathology. Now, there are apparently some DAP variables that are primarily related to personality factors, those that are primarily related to sociocultural factors, and those that reflect both factors as they interact. As people age, there is an increasing tendency of their drawings to become absurd, incongruous, fragmented, and primitive. For the HTP, well, there are few available norms and little material available concerning age-related differences. Range of applicability and limitations for both DAP and HTP. DAP is very useful because it takes very little time to complete, typically about 5 to 10 minutes, and it is easy to administer and it can be administered to a wide range of patients or clients ranging in age from early childhood, perhaps 3 or 4, and to old age. It is specifically useful with shy, inhibited, or otherwise nonverbal children and adults, and it is typically non-threatening. It is useful with patients who have a wide variety of language-related or speech-related problems and for people who do not speak the language of the clinician doing the assessment. The DIP also offers the examiner an opportunity to observe motor performance, an area that is hardly tapped in assessment batteries. The DIP has proven to be quite useful in reflecting improvement in psychotherapy and in sex therapy. Most people find the test non-threatening, and children typically find it quite engaging. Now, a very important reason for including the DAP in an assessment battery is that it is the only test in which there is no external stimulus or structure provided for the patient. There are no designs to copy and no vague images to examine. Since there is no external stimulus to copy or interpret, the clinician has an opportunity to observe the patient's functioning, where structure and organization must come from within. For those patients who cannot provide the inner structure necessary to do well on this task, it is possible to postulate a lack of developed sense of self. Now, for this reason, the DAP is so sensitive to psychopathology and to intrapsychic and interpersonal changes due to psychotherapy. The DIP is often useful for the assessment of patients who are evasive or guarded. Such patients often give barren records on verbal tests, but they are often less guarded on drawing tests because they are not familiar with what constitutes sound performance. Now, however, the limitations of the DAP include problems in movement or coordination and other visual perceptual problems, such as those seen in some neurologically impaired patients and in some aged patients. Patients with very low IQs produce rather meager drawings, and the DAP is typically not as useful with these patients as a personality measure. The DAP is not useful in testing patients who have had little or no experience in drawing, especially in drawing the human figure. On the other hand, for the HTP is used with children, adolescents, and less so the adults. Moreover, it is not useful a instrument if the clinician is seeking a test that can be scored objectively. For the cross-cultural factors for both DAP and HTP, DAP there are significant differences in drawings of both children and adults from cultures other than our own. It is important in the interpretation of drawings of patients from other cultures to understand cultural effects or so that they are not interpreted as personality issues. It is also helpful to determine the degree of acculturation of the patient to the mainstream culture in order to determine whether the use of traditional norms is appropriate. On the other hand, for the HTP, as with DAP, there is a significant differences among HTPs of subjects and patients of various cultures. For the current research status for both DAP and HTP, many studies demonstrate the validity, especially in reflecting psychopathology and in reflecting change in psychotherapy. Complicating problem is that individual signs may have a complex relationship with psychopathology. Therefore, in doing DAP research or interpreting DAPs in a clinical setting, the use of hypothesized signs in isolation does not work well, and it is not considered good science. Isolated variables taken out of context often produce non-significant or misleading results. So that's one of the concerning research. The second issue that makes research concerning the validity of the DAP difficult and complicated concerns the perceived source of the stress or conflict experienced by the subject. The more emotionally disturbed a patient is, the more there is disturbance. It could be in a body image and in reality testing, thereby resulting in major distortions in the drawings of disturbed patients. State straight, I'm sorry, State trait issues are important as well in research as well as in clinical application of all assessment instruments. It is possible with a DAP to determine whether the results are due to situational or the state stress or to more central or the trait issues. Moreover, for the HTP, there are relatively few reliability and validity studies available for the HTP. Thus, the HTP is rough or non-specific measure of pathology, but it is an undifferentiated measure. Used in clinical practice, DAP is helpful if the interpreter attempts to imagine being the person drawn and to then describe feelings and thoughts using self-reflection. And the interpreter might ask, how do I feel about myself? How do I approach others? How do I need in order to feel safe in my world? The interpreter could also use knowledge of specific drawing variables to round out the interpretations. The clinician should then adopt the stance of generalized other by observing his or her own reactions concerning how others who might interact with a person drawn would experience him or her. Questions such as, what would it be like to be this person's friend, his or her child, parent, or an employer? How does this person approach new relationship with others? And how does this person want others to experience him or her? So these questions help to understand the patient's presentation of self in his or her interactions with others. Moreover, for the HTP, although there is no agreement concerning what the house and tree symbolize, other than a representation of the self, the house is sometimes said to represent the part of the self that is concerned with the body. However, it is also said to represent nurturance, stability, and a sense of belonging. While the tree too is said to represent the self as representing the patient's sense of growth, vitality, and development, there is little research concerning interpretive guidelines, but the analysis of the house and tree parts is often identified with various aspects of the self. Now, for the next one is kinetic family drawing technique, or the KFD. The KFD is a projective technique that asks the individual to draw everyone in your family, including you, doing something. Now, it is used in personality assessment or art therapy, family treatment settings, and in special education settings. The KFD is said to facilitate the emergence of the subject's perception of dynamic relationships among family members, as well as individual adaptive and defensive styles in relation to family functioning. For the test development, the KFD was developed from the Draw a Family test, in which the patient is asked to draw a family without instruction for action. Burns is the one who developed a scoring method that involves, in part, the actions depicted, the physical arrangements and proximities of the figures, and the presence and characteristics of certain drawing styles that are said to represent psychopathology. Now, other researchers have used different scoring variables, such as distortion of body parts, line quality, and the sexual differentiation, thereby creating difficulty in the ability to compare studies concerning the reliability and validity of the KFD. For the psychometric characteristics, existing KFD scales can be scored with a high degree of inter-rater reliability. Test-retest reliabilities are also quite good. Now, in order to interpret the KFD accurately, it is necessary to understand how age and sex-related norms are reflected in the drawings. Otherwise, the clinician might interpret such variables as indicating psychopathology. The validity of the KFD is difficult to ascertain due to the inconsistent use of various scoring systems. For the range of applicability and limitations, the KFD allows clinicians to obtain a quick understanding of the patient's view of his or her family and of his or her position in the family, including interaction patterns and relationship patterns as the patient experiences them. It is helpful in understanding and the presenting complaint and its meaning for family dynamics, and it illuminates the effects of the prevailing culture and subculture on the patient's personality development. Now, the results indicate that caution is necessary when interpreting the KFD to ensure that variables are not scored as pathological rather than as reflecting developmental and or gender differences. For the use in clinical practice, the KFD is used in clinical practice primarily as a way to understand a child's or adolescent's view of his or her family structure and dynamics. It is best used with an interview and other assessment instruments to build a unique picture of the patient's view of himself or herself as a family member. Quite useful in psychotherapy with children and adolescents, and are also quite useful when shared with parents in order to sensitize them to the existence of family relationship problems. And that's all for my report. Thank you so much for listening. Have a great day.